Hello, my name is Tony Lee. I'm a second year MPH student at CSUSB, and this presentation is on my thesis research called Pandemic-Related Caregiver Burden Among Public Health Workforce, Mixed Method Analysis. I'll start with some background information on COVID-19, which many of you might already be aware. In December 2019, a highly contagious novel virus was discovered in China. Shortly after, the World Health Organization termed Coronavirus Disease 2019, COVID-19 for short, and declared a pandemic state in March 2020. Since, COVID-19 has resulted in significant morbidity and mortality throughout the world. In 2020, it was the third leading cause of death in the United States. The healthcare workforce, which consists of physicians, nurses, emergency medical personnel, and other professions caring for individuals with illness, is at increased risk for COVID-19 transmission, particularly those who work in patient care settings with direct exposure to and prolonged close contact with COVID-19 patients. With concerns for their own physical safety and the increased demands of the healthcare system itself, it's been found that the healthcare workforce has experienced significant psychological distress, including depression, anxiety, insomnia, fatigue, and burnout. Now, while the current body of literature primarily focuses on healthcare workforce, there's limited literature on the public health workforce. Public health workforce consists of epidemiologists, contact tracers, case investigators, public health educators, along with several other professions working in public health sectors. Few studies indicate that public health workforce also experience significant psychological distress, including depression and anxiety. Importantly, the prevalence of post-traumatic stress disorder among the public health workforce is higher than the prevalence among healthcare workers and the general public. So this study aims to assess the mental health outcome of public health and the related workforce resulting from the COVID-19 pandemic. This study utilized a convergent parallel mixed method approach, which is integrating quantitative and qualitative methods. And for data collection, the study used a mix of convenience sampling followed by snowball sampling. An anonymous survey through Qualtrics was disseminated to 5 public health and related professionals. Next, each participant was asked to share the survey with 5 additional colleagues working in public health or related fields. The survey consisted of 16 questions, including 2 demographic questions. Some were closed-ended questions, and some were open-ended, which the participants typed in their responses. Quantitative data analysis was performed using the SPSS, and qualitative data analysis was performed using the grounded theory, which consists of open, axial, and selective coding to identify a central theme, which I'll go over in a few minutes. But first, I'll review the quantitative results. Among the 17 people who participated in the study, the majority of the study participants were female and in the 25 to 34 years of age group. This pie chart illustrates that 65% of the study participants reported that their personal lives were impacted by providing COVID-19 related services. Next, we assessed feeling tired or fatigued among study participants, and 88% of the participants felt tired or fatigued after their sleep at least once a week to nearly every day. And 88% of the study participants felt tired, fatigued, or not up to par during their wake time at least once a week to nearly every day. Finally, This bar graph illustrates the psychological distress symptoms within the past 30 days among the study participants. The dark blue represents those who reported feeling nervous, hopeless, restless, or fidgety, so depressed that nothing could cheer them up, that everything was an effort, or worthless at least some of the time to all the time within the past 30 days. So as you can see on the graph, more reported feeling nervous or restless or fidgety. So 65% of the study participants felt nervous, and 71% of the study participants felt restless or fidgety at least some of the time to all the time during the past 30 days. Next, I'll review some of the qualitative data analysis. From all the open-ended questions that the study participants typed in, these are a few of the responses on how their personal lives were impacted due to providing COVID-19 related services. There is too much burden among staff and healthcare workers. Seems like there's no stopping point at all whatsoever. It feels that it has been non-stop. People believing everything they see or read on the internet and decide to call the call center to tell us we're lying to them. Disruptive individuals who are angry about following compliance rules. Using grounded theories, open and axial coding, several emergent subthemes were identified from all the responses, which are mental health burden to the workforce, stress to their home, family, and friends, limited staffing and workload resources, training needs for the staff, limited access to healthcare and social services for the general population, education needs for the general public to address any misinformation, and incongruent policies or inconsistent practices across jurisdictions and systems. These subthemes were then narrowed down to burden to the workforce, including mental health burden, social capital, which is to ensure services to address needs and maximize quality of life, micro-level resources, such as needing additional staffing, and macro-level resources, which are infrastructures outside of an organization. Example would be funding and policies. Finally, one central theme that emerged from the analysis is capacity building. Capacity building addresses the limited resources for healthcare and public health workforces to adequately meet the increased demands of the general population during the pandemic. And what I mean by capacity building is ensuring the public health and related workforces to have sufficient financial and human resources to preserve and sustain, thereby fulfilling the caregiver role in the profession. In other words, when the caregiver is well, the care receiver, the general population, benefits, maximizing quality of life for all. In conclusion, the overarching theme that emerged from this study is a paradigm shift in capacity building for public health emergency response. It calls for focusing on investments in public health and related workforces, which is already underfunded and understaffed. The study results highlight the importance of addressing the caregiver burden among public health and related workforces to protect the integrity of the vital services. Finally, I would like to thank the Office of Student Research for organizing the Student Research Symposium, as well as their support to fund this research. Thank you for listening to my presentation.